Welcome to the deep dive. Today we're tackling a topic that might make you go, canine and feline false pregnancy, sometimes called pseudopregnancy.
Yeah, it's a really fascinating look at biology, actually. And, we call it false pregnancy, but the hormones, they're very real. It's a totally normal part of the cycle for female dogs and cats.
Exactly. So we're going to dig into, well, the why behind it, why this happens in female dogs, bitches, and cats, queens. It might be surprising that even without being pregnant, their bodies are going through these genuine hormonal shifts.
And our sources for this deep dive, they cover quite a bit: the definition, the biology underneath it all, how common it is, the signs you might see, what triggers it, and, how it's usually managed.
Right. So our mission today is really to understand why this happens, what you as a pet owner might actually observe, and whether it's something you generally need to worry about.
Okay, let's start with the basics. What is false pregnancy? In dogs, in bitches?
Okay, so for bitches, it's basically physical changes, and behavioral ones too, that are driven by completely normal hormone shifts during a specific part of their cycle.
Right, that's the diestrus phase after their heat, and maybe the very beginning of estrus, which is the quiet period after.
And this happens even if they haven't conceived. That's why the name false pregnancy is a bit of a misnomer, like our sources say. The hormones are just doing what they normally do.
Yeah, exactly. And it's pretty similar for queens, for female cats. If they have a non-fertile mating or sometimes even just ovulate spontaneously, they can show similar signs: physical, hormonal, behavioral changes.
It's just their normal reproductive system kicking in. Now, here's something that really stands out from the sources. The hormone levels, the profiles of pregnant dogs and non-pregnant dogs are actually very, very similar right after ovulation.
That's such a key point. Every cycling bitch, pregnant or not, goes through this really long period, like over 2 months, called diestrus. And progesterone levels are high throughout that time.
So that's sustained progesterone, and then another hormone, prolactin, which kicks in later. That's what drives the mammary glands to develop, and those nesting behaviors.
Exactly. Progesterone sets the stage, and then prolactin really pushes the maternal behaviors and milk development towards the end of that phase. It makes you wonder, about the body's logic. Maybe it's preparing just in case.
And what about the actual milk production? Galactorrhea, is that the term?
Yeah, galactorrhea. That's usually triggered by a surge in prolactin right as diestrus is ending. And interestingly, the sources mention a link to severe hypothyroidism.
Oh, an underactive thyroid.
Yeah, apparently severe hypothyroidism can sometimes cause prolactin levels to go up, which could then lead to these false pregnancy signs. So maybe sometimes it's a clue to look deeper.
That's interesting. Okay, but what about the why? Especially for dogs, there's this really cool evolutionary idea.
Oh, absolutely. The theory, and it's pretty widely accepted, is that it's kind of an evolutionary leftover from when dogs lived in packs.
Like wolves.
Exactly. So imagine in a pack, maybe multiple females cycle around the same time, but perhaps only the dominant female actually gets pregnant.
Okay.
Well, if the other females also went through these hormonal changes, developing mammary glands and maternal instincts, they could potentially help nurse the dominant female's puppies if needed.
Wow. So communal nursing, that would definitely boost the survival rate of the pups.
Precisely, a survival advantage for the whole pack. So it's this deep-seated biological mechanism.
That makes so much sense, a real aha moment.
Yeah.
So this ancient mechanism, helpful back then, can sometimes get triggered, maybe more obviously in our pets today. What are some triggers that make it really noticeable?
Well, basically, any event that causes progesterone to drop quickly while prolactin is rising or about to rise can trigger a really overt false pregnancy.
Okay. And the sources mention something specific related to veterinary procedures.
Yes, spaying. If a bitch is spayed ovariectomy or ovariohysterectomy during the middle or later part of diestrus, when progesterone is high.
The surgery removes the source of the progesterone.
Exactly. So progesterone plummets rapidly, and that can iatrogenically, meaning caused by the medical intervention, induce a false pregnancy.
Right. So even a routine spay, if timed during that window, can lead to these temporary signs. What about cats again? Does ovulation work differently?
Well, queens are induced ovulators mostly, meaning mating triggers ovulation, but they can also ovulate spontaneously sometimes. If they ovulate but don't get pregnant, they also have a diestrus phase, about 6-7 weeks long, with high progesterone.
So false pregnancy technically happens in cats too after non-pregnant ovulation.
Yes, every time. But, and this is the key difference, you're much, much less likely to see really obvious, overt signs in cats compared to dogs. It's usually much more subtle, if noticeable at all.
Okay, that's a good distinction. So, given that the hormonal changes are basically universal in dogs after ovulation, how often do we actually see signs? Let's talk prevalence.
It's incredibly common in bitches. Our sources state that hormonally, false pregnancy happens in 100% of cycles after ovulation.
100%.
Yeah. And in terms of noticeable signs, clinical signs, over 60% of cycling bitches show them to some degree.
Wow. So, chances are, if you have an unspayed female dog, you'll probably see some signs at some point, even mild ones.
Very likely, yes. For queens, spontaneous ovulation happens quite a bit. The sources give a range, maybe 35% up to 85%, depending on things like if other cats are around.
And false pregnancy follows each time they ovulate but aren't pregnant.
Right, but again, overt signs are rare in cats.
Okay, so it's happening hormonally all the time in dogs, but we might only notice a more dramatic acting pregnant behavior sometimes. So for owners who are seeing weird things, what should they look for? How do you recognize the signs?
Well, signalment first. It can affect any dog or cat breed, any age after they start cycling, and obviously only females. And remember, the signs in dogs can vary a lot.
Even in the same dog from one cycle to the next?
Absolutely. One cycle might be really obvious, overt the next, barely noticeable covert. And again, overt signs are pretty uncommon in cats.
Okay. What about history? Anything in the timeline that points towards it?
Yeah, you typically look back. Did she have a heat cycle, an estrus, maybe 6 to 12 weeks ago? For queens, it's usually around 40 days prior. Or, like we discussed, was she spayed recently? Maybe in the last 3 to 14 days.
Got it. And physical signs, what might you actually see?
You might see the mammary glands getting bigger, developing. You might see some milk or fluid discharge. That's the galactorrhea. It can look clear or milky, sometimes even brownish.
Okay.
Some dogs might gain a little weight. Rarely, you might even see some abdominal distension, like their belly looks a bit swollen.
And the behaviors, I imagine those are often the first thing owners notice.
Often, yes. Classic signs include nesting, digging in blankets, arranging bedding. Mothering behavior is really common, carrying toys around, protecting them like they're puppies or kittens.
No.
Yeah, but sometimes it's less cute. They might become more aggressive or protective of their nest or toys. Lethargy is possible too, just seeming low energy. And sometimes, maybe surprisingly, they might go off their food a bit.
Okay, so quite a range of signs. Let's just quickly recap the cause again. What's the core biological driver?
It really boils down to that hormonal shift. Progesterone levels dropping after being high during diestrus, and prolactin levels rising. Prolactin is key. It's the milk and mothering hormone, basically.
And spaying during diestrus causes that sharp progesterone drop.
Exactly. And don't forget that potential link with severe hypothyroidism causing high prolactin too. It's less common, but worth remembering.
Right. So an owner sees some of these signs, they call the vet. How is it usually diagnosed? And maybe more importantly, what else could it be? How do you rule out other things?
Diagnosis is often based on the history, recent heat cycle, or spay, and the clinical signs themselves. Usually, extensive tests aren't needed unless you need to rule out other conditions.
And the main thing to rule out is actual pregnancy.
Absolutely, that's number one. But there are other possibilities too. Things like mastitis, that's an infection or inflammation of the mammary glands. Mammary tumors need to be considered. In dogs especially. Pyometra, a serious uterine infection, is a major concern that can cause lethargy and sometimes abdominal swelling. Other causes of abdominal swelling need thinking about, and much more rarely it may be a pituitary issue or the hypothyroidism itself. For cats, you'd also add mammary hyperplasia to that list.
Do blood tests or x-rays play a role?
They can. Blood work might show subtle changes like mild anemia or high cholesterol during diestrus. Hormone tests can confirm high progesterone if you test during that phase. But mostly, these tests are used to check for other problems, like infection markers for pyometra or to confirm the cycle stage.
And imaging, ultrasound.
Ultrasound and x-rays are really useful, primarily to check for pregnancy, can we see fetuses? Or to look at the uterus, check for pyometra.
Okay, so let's say the vet confirms it's most likely false pregnancy. What's the usual approach? What do you actually do about it?
Well, the good news, and this is important for owners to hear, is that in most cases, you don't need to do anything specific. It usually resolves completely on its own.
Really? That must be a relief.
It is. Management is generally outpatient, just focused on managing any symptoms that are bothering the pet or the owner.
How long does it typically take to resolve?
Usually within about 2 to 4 weeks, things go back to normal without any treatment.
Okay. So what kind of supportive care can owners provide at home during that time?
Some simple things can help. If she's licking her mammary glands a lot, using an Elizabethan collar, the cone is important.
Because licking stimulates more milk production.
Exactly. You want to avoid that stimulation. Applying cool compresses or cold packs gently to swollen mammary glands can help with discomfort.
Makes sense.
And maybe some lifestyle tweaks. If the dog is suddenly very lethargic or nesting all day, encouraging a bit more gentle activity can help. And slightly reducing food intake can sometimes help decrease the energy available for milk production, but you need to be careful not to cut back too much.
Okay. But what if the symptoms are really severe, like really significant behavioral changes or a lot of milk? Are there medications?
Yes, definitely. If the signs are causing significant distress or discomfort, or major behavioral issues like aggression, then medication is an option. The main drugs used are called dopamine agonists.
Dopamine agonists, how do they work?
They work by suppressing prolactin release from the pituitary gland. Less prolactin means less milk production and usually a reduction in those intense maternal behaviors. Cabergoline and bromocriptine are the common ones.
Cabergoline and bromocriptine, how long would they typically be used for?
Usually a short course, maybe 5 to 7 days, is enough to resolve the signs much faster than letting it run its course naturally.
Are there any risks or side effects with those?
Yes, there are things to be aware of. Critically, you must be sure the animal isn't actually pregnant before using them,
What's that?
because they lower prolactin, and prolactin is needed to maintain pregnancy, especially in dogs. So giving these drugs to a pregnant animal can cause abortion or premature labor.
Okay, that's crucial. Any other side effects?
Bromocriptine can sometimes cause vomiting, so giving it with food helps. Cabergoline generally has fewer side effects, but it tends to be a bit more expensive. Rarely, with long-term use, some dopamine agonists have been linked to coat color changes in dogs.
And drug interactions.
Yeah, you want to avoid using them at the same time as certain other drugs, like acepramazine, a sedative, or metoclopramide, an anti-nausea drug, because those can actually increase prolactin and work against the treatment.
Got it. Are there any other medication options mentioned in the sources?
Yes, a couple of others are sometimes considered. For really extreme behavioral signs in bitches, like severe anxiety or aggression associated with the false pregnancy, a vet might consider short-term use of diazepam.
Like Valium.
Yes, and another drug, mebelorone, can sometimes be used short-term to reduce symptoms or even longer-term to prevent future heat cycles altogether in bitches. But it's not for cats, and it has potential side effects, kind of masculinizing effects, so it requires a careful discussion and informed consent.
Okay, so once the episode is resolving, either on its own or with medication, what about follow-up? Anything owners need to watch for?
The main thing is to keep an eye on the mammary glands for any signs of mastitis infection. Look for increased heat, redness, pain, swelling, or any abnormal discharge that looks like pus. If you see that, definitely call the vet.
And looking ahead, how can you prevent this from happening again?
The most effective way to prevent false pregnancy permanently is to spay the animal. Ideally, the timing should be during estrus, the quiet period, or maybe very early diestrus to avoid triggering it.
So spaying is the long-term solution. Any other options?
Estrus suppression using medications is another possibility if spaying isn't desired for some reason, but that's something to discuss in detail with your vet, weighing the pros and cons.
Right. And we mentioned mastitis as a potential complication. Is that the main worry?
Yes, mastitis is the primary complication to be aware of, especially if there's a lot of milk production and the glands get engorged or bacteria get in.
But overall, the outlook is generally good.
Very good. Like we said, it typically resolves within 2-4 months without treatment, or maybe 5-7 days with medication like Cabergoline. The key thing for owners to understand, though, is that if their pet isn't spayed, it can happen again after any future ovulation. It's linked to the cycle itself.
Okay, so let's try and sum up this deep dive. False pregnancy or pseudopregnancy, it's a really common, normal hormonal event in female dogs, and it happens in cats too after they ovulate but aren't actually pregnant.
Exactly. And while it usually goes away on its own without causing any major problems, recognizing the signs, the nesting, the mothering toys, the mammary changes is definitely important for pet owners.
And just to reiterate, those hormonal changes themselves, totally normal physiology. It's just that sometimes the outward behaviors seem a bit, well, unexpected if you don't know what's happening.
Right. And importantly, having a false pregnancy generally doesn't impact their future fertility. They can usually go on to have puppies or kittens later if desired.
And the bottom line, as always, if you're worried about your pet, if the signs seem severe or if they're just not getting better, definitely talk to your vet. They can confirm what's going on and recommend the diligent approach.
Absolutely. Thinking about all this, these intricate hormonal cycles in our pets, it really highlights the incredible complexity of biology, doesn't it? And how behavior is so tightly linked to these internal
It
processes.
really does.
And it makes you wonder, that evolutionary angle we discussed, the pack nursing theory, what other biological phenomena that maybe seem strained or, non-productive on the surface actually have these deep-rooted evolutionary purposes that we're maybe only just beginning to understand across different species? It's kind of fascinating to think about.